Tashidelek, Namaste and hello to all the participants of elective module on Introduction to Sowa-Rigpa System of Medicine. I am Dr. Namtul Hamo, Vice Principal and Faculty Member at Mensikhang Sowa-Rigpa Medical College and Hospital in Dharamsala. Before I start my lecture on the Introduction to Sowa-Rigpa System of Medicine, let me first pay homage to the Medicine Buddha, the King of Physicians. With compassion serves all sentient beings. O enlightened one, mere hearing your name relieves the sufferings of all lowly birds, healer of the diseases of the three inborn mental poisons. To the enlightened supreme healer, the King of Ecomerine light, I prostrate before you. And then let me pay homage to the Buddha of compassion, His Holiness the 14th Dalai Lama. In the heavenly realm of Tibet, surrounded by a chain of snow mountains, the source of all happiness and help for beings is His Holiness Tenzin Gyatso Avalokiteshvara in person. May his life be secure for hundreds of eons. To begin my lecture on Introduction to Sowa-Rigpa System of Medicine, I will be talking about the introduction of the Sowa-Rigpa under the following 7 subheadings, beginning with definition of Sowa-Rigpa, followed by its historical account, fundamental principles of Sowa-Rigpa, and highlight distinctive features of Sowa-Rigpa, followed by scope of Sowa-Rigpa system, current status of Sowa-Rigpa, and finally a list of bibliography for your reference. First of all, let me explain the definition or meaning of Sowa-Rigpa. Sowa-Rigpa is actually a Tibetan language. Sowa means to heal or restore from a setback or an illness, and Rigpa means knowledge or science. So collectively, Sowa-Rigpa is a science or knowledge of healing, which is one of the 5 major traditional Tibetan studies, which are the science of grammar, science of Sowa-Rigpa, science of arts, science of Buddhist logic, and Buddhist philosophy. Out of these 5 great traditional Tibetan studies, Sowa-Rigpa and Buddhist philosophy are the 2 major contributors to the physical and mental well-being of humanity. Talking about a historical account of Sowa-Rigpa, Sowa-Rigpa system of medicine is one of the oldest known medical traditions, and it is quite an advanced medical tradition for its time, despite very limited resources and scientific developments during those periods. It is in fact as old as the Tibetan civilization. Diseases have come along with the human civilization, and the oldest or the earliest inhabitants of Tibet, like in any part of the world, have struggled to overcome their daily health issues by experimenting with the use of natural resources available around them. Through this way, they have discovered various remedies, for example, using hot boiled water for indigestion. The first ever known or documented disease and remedy in the history of Sowa-Rigpa. First disease as the indigestion, and the first remedy is the hot boiled water. Then also use of melted butter for bleeding, as well as use of compress made from residual barley grains from the extracted medicinal wine, which is called as chang in Tibetan, for inflammation and swellings of the wounds. Through this way, they have accumulated healing knowledge, which over a period of time have been passed on from one generation to next, and later on contributed to the foundation of the earliest medical tradition of Sowa-Rigpa system. Even the oldest inhabitants of Tibet have learned medical knowledge from animal behaviors in their way of tackling the health issues such as an injury. Later on, the Bon religion, the indigenous Bon religion or culture, which was widely practiced and prevalent in Tibet before Buddhism came in, had its share of influence on the development of Sowa-Rigpa system of medicine. There was a history of legendary Bon master called Tempa Sherab Meoche, who came during the same time as the Lord Buddha. He had propounded numerous medical teachings, and amongst other disciples, his own prince, Chepotishe, learned these medical teachings and practice from his father. So through this way, Bon medical tradition or the Bon culture or religion had a great influence on the development of the indigenous Sowa-Rigpa system of medicine. Then later on, there was this huge contribution from the successive emperors of Tibet, the era of which is called as the Golden Era for the development of the Sowa-Rigpa in particular and Tibetan tradition as a whole. Especially in the 7th and 8th centuries and onward, there was this beginning of era for the opening of door for the exchange of knowledge from the other medical systems available in the neighboring countries surrounding Tibet. Especially in the 8th century, during the reign of the 38th king or the emperor of Tibet, King Trisong Dyuzen, he had for the first time organized a medical conference at Samye Monastery in Tibet by inviting scholars from different medical systems from neighboring countries such as India, China, Nepal, East Turkestan, and Persia. So during this golden era of the development of Sowa-Rigpa, there was this huge exchange of knowledge taking place from the medical traditions of the surrounding countries, and also numerous translation of the literatures, valuable literatures from other medical systems were also done. So also incorporation of the supreme medical practices from the other medical traditions into the Sowa-Rigpa system of medicine. Then I should mention the name of Yudo Gyöndeng Gompo, who is popularly known as the father of Tibetan medicine. His contribution towards shaping the most celebrated medical text of Sowa-Rigpa, which is called as Gyushi, was unsurpassable. And his lineage, which is called as Yuthok lineage, pervaded all over Tibet. And during the 15th century, from the parent Yuthok lineage, it bifurcated into two great lineages of Sowa-Rigpa tradition, and they are called as Changpa tradition and Suga tradition. Changpa tradition was founded by Changpa Namgyal Tarsang, and the tradition was spread more in the north region of Tibet. And the second tradition, called as Suga tradition, was founded by Suga Nyamnya Doche, which was more prevalent or practiced in the southern region of Tibet. These two medical traditions, though based on the same source of lineage, which is Yuthok lineage, and also based on the same kind of medical text, Gyushi, they had some differences, especially in the elucidation of certain concepts in the medical text and identification of medicinal plants, application of therapeutic methods, and medicine formulation. All these differences arose due to the differences in their climatic and geographical conditions, the natural resources availability in these two regions, and the lifestyle and the dietary habits of the peoples inhabiting in these two regions of Tibet. After this golden era, successive Dalai Lamas, particularly the 5th, 13th and 14th Dalai Lama, had contributed immensely towards the further development of Tibetan medicine. In around 7th century, during the times of His Holiness the 5th Dalai Lama, there was this renowned Sowa-Rigpa scholar, Desi Sangye Gyatso, who was appointed as regent by the 5th Dalai Lama, and Desi Sangye Gyatso was well versed in all the traditional Tibetan studies, and he had produced 79 medical tangas, each depicting various concepts of Sowa-Rigpa. He had written very famous commentary on Tibetan medicinal text Gyushi, which is called as the Blue Barrel, Binduru Ngompo, and a famous commentary on Tibetan astroscience called Bindure Karpo, called White Barrel. And he established Chakpura Medical College in 1696, which produced well-known graduates from Chakpura Medical College, including Venerable Kherap Nopo. And during the time of the 13th Dalai Lama, when Kherap Nopo was appointed as the personal physician of the 13th Dalai Lama, and he was also appointed as the director of both Chakpuri Medical College and Lhasa Menzikhang College, which was established by the 13th Dalai Lama at Lhasa in Tibet in 1916. Under the tutorship of Venerable Kherap Nopo, well-known personal physicians to His Holiness the 14th Dalai Lama, such as Dr. Tenzin Chodak, Dr. Lobsang Wangyal, and Dr. Yishit Thunden, who was the Padma Shri awardee, and also famous lady Tibetan physician Yanche Lamo, who was an expert on cataract surgery. Dr. Kherap Nopo had contributed numerous literatures on the use of Tibetan medicine and pharmacology, as well as tree concept mapping called as Dongdem. And in 1961, His Holiness the 14th Dalai Lama, after Tibet being occupied by the Communist Chinese government, His Holiness the 14th Dalai Lama re-established Menzikhang in 1961 at Dharamsala, Himachal Pradesh. And Menzikhang, which was established by His Holiness the 14th Dalai Lama in 1961 in Dharamsala, is the pioneering and oldest Sowa-Rigpa institute outside Tibet in India. It is the charitable, cultural, and educational institute which is the main center for the studies of Tibetan medicine and Tibetan astroscience. This institute runs two Sowa-Rigpa colleges at present, one in Dharamsala and another in Bengaluru, as well as 7 other cultural departments in addition to the administrative department, and over 60 OBDs spread across India, Nepal, and abroad, catering to the healthcare service of people irrespective of religion, race, and background. And this institute had graduates amounting to almost 400, many of whom are serving in the different departments and clinics of the Institute of Menzikhang, as well as they serve as the heads and faculties at the Sowa-Rigpa colleges in other parts of India as well. Fundamental principles of Sowa-Rigpa. First of all, we need to know why study Sowa-Rigpa, or you can say aims and objectives of studying Sowa-Rigpa. Those who wish to remain healthy and cure diseases, others, as well as oneself, and those who wish to have a long life and to practice Dharma, accumulate wealth, and achieve happiness, or to free oneself from the sufferings of illnesses and gain reverence from others. In short, the objective of learning Sowa-Rigpa is to provide to the evergreen tree of our body system the 2 blossoming flowers of health and longevity, and the 3 precious fruits of spirituality, prosperity, and happiness. And coming to the introduction about 4 medical tantras called as Gyushi. It is the fundamental medical text which is widely used by all the aspiring Sowa-Rigpa physicians and scholars. It encompasses 5,900 verses with 156 chapters. And it is composed of 4 volumes, usually known as the 4 tantras. And the first tantra, called as the root tantra, is about the synopsis of the whole Sowa-Rigpa system. It composes 6 chapters, beginning with the prologue, enumeration, health and disease, diagnosis and treatment, followed by a summary. And the second tantra, called as the explanatory tantra, is about the object of applying treatment, body and disorder, and the treatments and the healer or the physician. It is composed of 31 chapters. And the third tantra, the oral instruction tantra, has 92 chapters and is about the treatment of diseases from head to toe. And it is summarized under 15 categories and branches of diseases, which are the branch of general medicine, pediatrics, gynecology, mental disorders or diseases inflicted by the evil spirits, injury caused by trauma, toxicology, aging and rejuvenation, and restoration or treatment of infertility and impotence. And the fourth tantra, called as the subsequent tantra, is about the practices. And it is composed of 25 chapters, which is summarized under the 4 compendiums. And the first is the compendium of pulse and urine examination, compendium of pacifying medication, compendium of evacuative therapies or medication, and compendium of mild and strong external therapies. Next is about the concept of 5 elements, called as Jungwa in Tibetan. Our medical text Gushi quotes, "This human body is composed of the 5 elements. Even the diseases to be healed are also generated by the 5 elements. And also the medicines or remedies which are used to treat the diseases also have the nature of the 5 elements. Therefore, the human body, disorders and remedies, all 3 are interrelated because of their same nature or the components or the building blocks, which are called as Jungwa. And the 5 elements are earth, water, fire, air and space. Earth gives the foundation. Without earth, no formation will take place. And water gives the fluidity, and it gives the opportunity for cohesion or formation. And fire is the warm energy, which is important for the maturation. And air is the movement or the energy of movement, which facilitates growth. And the space provide the opportunity and the space for the growth and development. So all these 5 elements, each contributing different bodily structures of the human body. Next is about the 3 Nyepa or the 3 principles or bioenergies, which are Lung, Tipa and Pekin. These are called as Nyepa, literally meaning folds, which means that these 3 Nyepa can result in health and, if imbalanced, can give rise to diseases. Because of that, it is called as 3 folds or Nyepa. Lung is generated from air element. It has 6 characteristics, out of which the predominant characteristics are the light and mobile characteristics. And it is physiologically neutral in its functions, which means that it can accompany both the hot and cold conditions of our health status. And Tipa is generated from fire element, which is a warm energy. It has 7 characteristics, but it is predominantly warm or hot in its characteristics. And Pekin is generated from combination of earth and water element, and pagan also has 7 characteristics, predominantly moist and heavy, and it is by nature cold. These 3 bioenergies, or the principal energies, must stay in a balanced or homeostatic relationship in order to create health. And if imbalanced, or if we lose this homeostatic relationship of these 3 energies, can result in disease. And the key bodily components are the tissues and the waste, or they are the objects where actually the diseases manifest in the form of symptoms which can be examined. And the 7 bodily constituents we call as leçons d'une, they are nutritional essence: blood, flesh, fats, bone, bone marrow, and regenerative fluid. Nutritional essence is formed actually from what we eat and drink through the process of digestion and absorption. Nutritional essence is absorbed in our blood, and it gives rise, or it is the precursor or source of the synthesis of the successive bodily constituents. And the waste or the residual byproducts are the 3 main waste which we call as feces, urine, and perspiration. There are other minor impurities or waste byproducts which are produced from the successive 7 bodily tissues. For example, bile, sebum, fecal fat, and the excretions from our body orifices like ears, eyes, nose, and so on. These are under the category of the minor impurities which are formed from the bodily tissues we call as leçons d'une. Then there is this important bodily component known as chuser in Tibetan, which is loosely translated as serum, or sometimes I translate it as a plasma ultrafiltrate, because blood and chuser is the main source, is one of the important source or disease factor which give rise to so many other diseases. Then there is another bodily component called as sin in Tibetan, which is actually the microbiome or the microorganisms in our body. We see that there is about 84,000 microorganisms within our body which live within us in a symbiotic relationship manner, which means that our body and the microorganisms help each other for sustenance. And any imbalance within our body due to some wrong dietary habits can result in the disturbance of these microorganisms within our body, and thereby they can also harm our body. So these are the important key bodily components of our body according to the Sowa-Rigpa system of medicine. Then comes the concept of health and disease in Sowa-Rigpa system of medicine, how we define health and disease in Sowa-Rigpa system of medicine. We define health as a state of health when the 3 principal energies, 7 bodily constituents, and the 3 waste products, which I already explained in the previous slide, they exist in a balanced state in terms of quantity and physiological function. It is a state of harmonious relationship between the body and mind. Contrary to the above definition, is called as a disease. Sowa-Rigpa has significant potential in contributing to both the physical and mental well-being. On the right side of the slide is the allegorical tree or the tree concept mapping I talked about, which was actually developed initially by Wen Kherap Norbu. Then mind and body relationship or connection in conception throughout the sustenance till the degeneration or death process highly emphasized and important according to Sowa-Rigpa system of medicine. Let me highlight this connection between mind and body during the process of conception according to Sowa-Rigpa system of medicine. There was this explanation about the cause of conception. The three main causative factors, indispensable causative factors necessary for the successful conception to take place are the healthy sperm and ovum of the parents, and the third important factor is the consciousness. And these three are the indispensable causes of the successful conception. Absence of any of these three factors will result in infertility or unsuccessful conception. In addition to these three causes, there is this importance of the law of causality or karma, compatible karma and accumulated merit of the father and the mother and the new being, which is important to come into place for the successful conception. Then, of course, there is this force of afflictive emotions which lead to the coming together or coming into place, all these causes for the conception to take place. And the importance of five elements, the five elements which are inherently present in all three factors, which are sperm, ovum, and the consciousness. So this highlight the importance of mind and body connection according to Tibetan medicine, and this is one of the example of Sowa-Rigpa system of medicine having relationship or backing of Buddhist psychology. On the right side of the slide, the picture below is one of the 79 medical paintings I talked about, which was developed in the 7th century by the regent Desi Sangye Gyatso. And this painting is about the embryology, depicts the whole process of fertilization or conception and embryology, showing the three important phases of fetal developments, beginning from the process of conception and through the three important phases of fetal development, which in Tibetan medicine is termed or called as the fish stage, tortoise stage, and pig stage. Then there is this very important concept of the body nature in Sowa-Rigpa system of medicine, or Rangshin, which we call in Tibetan. And this actually our body can be classified on the basis of different factors such as gender, where we classify our body as male, female, and neuter. And on the basis of age, we divide our body into the children or the child stage, adult stage, and elderly stage. While on the basis of the state of health, we can categorize as healthy state and disease state. And finally, on the basis of the constitution, we divide human body into 7 different constitutions depending on the predominance of which bioenergy or principal energy, whether it is predominant as a single entity or in a 2 combined entities or all combined, depending upon which we can divide or classify human body into 7 different constitutions. One can be identified on the basis of one's personality, sensitivity towards choice of taste in food, lifestyle, and the vulnerability that you have for the diseases. And it also is important factor for a physician to take it into account while diagnosing a disease and applying treatment. Then next is the concept of disease, in which we can talk about the cause of the disease. The 3 main causes of disease, or the root causes of disease, is according to Sowa-Rigpa system of medicine, can be traced back to the ignorance, which is the source or the cause of all the diseases. And we are all inherently born with the ignorance or the cause of disease. And the three causes which are actually derived from the root cause, that is the ignorant about the reality of the phenomena. And ignorance paves way for the three main mental poisons called as desire, hatred, and delusion. And these three mental poisons are symbolized by other diagram of a bird symbolizing desire, snake symbolizing hatred, and pig symbolizing delusion. And desire generates lung energy, and hatred generates tipa. Delusion generates pagan energy. So three causes are the desire, hatred, and delusion give rise to lung, tipa, and pagan respectively. And the four disease conditions, or we call it ken in Tibetan, and they are the season and the time and the mental factors or the influences from the evil spirits. Third is the diet, and fourth is the lifestyle. And these are the four conditions that trigger the cause of the disease to manifest really as diseases. And there's this 6 mode of disease entrances, which are the mode of pathogenesis, you can say, how the disease can spread in the skin and develop in the flesh, move or flow inside the blood vessels and nerves, how the disease can affect or infiltrate into the bones, and how disease can affect the vital organs, and diseases can inflict vessel organs. Then fourth is about the 15 pathways or location or Gulam Chönga, which are the pathways through which three principal energy related diseases can affect or can take its pathway in our body system. And fifth one is about the 9 factors of disease occurrence. Next comes the classification of disorders. Because there are innumerable disease manifestations, signs and symptoms, and somehow we have to categorize these diseases, and we have like 1,616 classification of diseases, which can be grouped under 404 types of diseases. This slide depicts the 404 classification of disorders, 104 classification of minor transient disorders where patient can survive even without any treatment given. They heal on their own. And 101 category of disorders influenced by evil spirits, and treatment should be focused on appeasing the disease-causing agent, followed by the medication. And third category of 101 diseases, which is by the causes of this lifetime, in which case patient needs to be treated, survived, or to be healed. And the fourth category of 101 classification of diseases are diseases caused by negative imprints from your past life, in which case death is imminent despite proper treatment. And these 404 classification of diseases can be further summarized into 2 types of diseases, which are diseases of the cold and diseases of the hot nature. So next comes the diagnosis. Diagnosis is very important, the correct application of the treatment methods. It is just like to have a correct object or correct place for the application of the treatment methods. There are 3 important diagnostic methods applied in Sowa-Rigpa system of medicine. We call in Tibetan as Tarik Tisum. Tawa means visual observation, which is where the physician observes the overall external appearance or the external body parts of the patient, including physical appearances, structure that can be seen and observed by the physician. as well as observing the color of the bodily parts, the complexion, and most importantly is the observation of the patient's tongue characteristics and urine characteristics in particular. And in the second method, which is the diagnosis by touch, where the physician, by using his physical touch, examines the patient's physical body, if there is any extra growth or changes in the texture. In particular, the diagnosis by touch is the examination of the patient through its pulse. And the most important pulse which is being used by the physician, diagnosis of the disease, is the radial pulse of the patient, right and left radial pulse of the patient. And third diagnostic method is through questioning, where the physician talks with the patient by asking mainly about the causes and conditions of the disease, which help to identify which particular bioenergy that is in imbalance state, and questioning about where the disease is, the location and the site of the disease, which helps you understand about the pathway, which part of the body, whether it is the upper part, middle part, or the lower part, or which particular organs is affected by the disease. And thirdly, signs and symptoms of the disease, which help to identify the correct diagnosis of the disease. The exclusive characteristics of diagnosis is that the impending death and the survival of the person is more clearly prognosticated through pulse reading, which means that pulse reading is more reliable for deciding or for prognosticating whether the person can die soon or patient can survive. And secondly, to determine whether the disease is of cold or hot nature can be determined or examined more clearly through urine analysis, because in urine we look for the color, the bubbles, the sediments of the urine, and the transformation of the urine color and the urinary components. These are examined in the urine analysis, because in particular the sediments of the urine, which is generated or formed from the or produced from the blood and deeper components of the body, is because of this reason that the hot and cold nature of disorder can be determined more clearly through urine analysis. There is this tenfold factors, which are the bodily components of the patient which has been affected with the disease, place and the season during which the disease has been manifested, and the nature of the patient, age of the patient, nature of the disorder, patient's digestive fire, bodily strength of the patient, food and lifestyle habits of the patient, and the location of the disorder. These tenfold factors help the doctor do the correct diagnosis of the disease and also apply the correct or suitable treatment for the patient. Then comes the fourth part, or you can say the treatment part. Treatment can be classified into 4 treatment methods, beginning with the diet or nutrition. Diet can be classified into healthy diet and unhealthy diet. So we must try to adopt a healthy diet and avoid unhealthy diet. And diet along with the lifestyle is not only for the treatment of the diseases as a preventive method. We must always be mindful of adopting healthy diet and lifestyle and stay away unhealthy diet and unhealthy lifestyle. Third treatment method is the medication. medication can be classified into pacifying, evacuating medications. Pacifying can be of hot potency medications and cold potency medications, where hot potency medications are prescribed for the cold nature disorders and cold potency medications are prescribed for the hot natured disorders. And second category of medication is the evacuative medication, or sometimes called as evacuative therapies, and that can be classified into mild and strong evacuative medications or therapies. Evacuative medications include emesis, enema, channel cleansing, and purgation, whereas pacifying medications, which is of cold and hot potency categories, can be in the form of different medicinal forms such as powder, pills, concentrated decoction, and liquid decoction, and so on. Then comes the fourth treatment method, which is the external therapies, or we call in Tibetan as che. That can be classified into mild, non-invasive type of external therapies and strong, which can be of invasive nature type of external therapies. In the case of mild therapies, we have different types of compresses, which can be of hot potency or cold potency form of compresses. And second type of mild therapy is the bath therapy. We call in Tibetan as lum, medicinal bath therapy, which can be natural in the form of hot springs, and non-natural type of lum or bath therapy can be by using different formulations made for treating different types of diseases. And strong category of external therapies include venesection or bloodletting and moxibustion, where we use medicinal herbs by burning it and then applying for different points in the body, meant for treating different types of cold-natured diseases, whereas venesection is meant to treat hot-natured disorders, where you let out the disease-affected blood from particular veins meant for treating different types of hot-natured disorders. Strong therapy also include some spoon therapies or surgeries, such as surgeries or procedure used for cataract intervention. This is the slide showing different types of external therapies. I forgot to mention about massage therapy. We call in Tibetan as kunye, which is a type of mild external therapy for treating mainly lung disorders, and particularly massage can be applied as a daily routine, especially on your head, feet, ears, for prevention of diseases. In this slide, which is the subheading related with distinctive features of Sowa-Rigpa, where I would like to highlight some of the unique features of Sowa-Rigpa system of medicine. And one of them is the relationship that the Sowa-Rigpa system of medicine shares with Buddhist philosophy. And one of the important Buddhist philosophy related matters which I already talked about is the cause of the disease, where you trace the root cause of the diseases, one's mental emotions. When we talked about the cause of the diseases already in the previous lecture. So also the ethical conduct of the physician is mentioned in the 31st chapter of the explanatory tantra, which is the second volume of the Kyushi text, where it is mentioned that the physician should not only be well versed in the knowledge or well educated, but also he or she should be compassionate, have dexterity, and have a bodhicitta mind or altruistic mind, and have consistent efforts in your service and be expert in the social conduct. Besides, when we talk about the outcome or the result that one or a physician can achieve, is not only for the temporary achievements of fame, power, joy, prosperity in this life, but also for the long-term achievement which the king of physician or the medicine Buddha himself said, that by avoiding pretense and desire and walk in the path of treating the patients, one can achieve the state of Buddhahood or nirvana. Then this important concept of digestive fire in Sowa-Rigpa system of medicine and its sensitivity, which is the basis of digestion, whether it's to do with the digestion of our food and drinks that we consume on a daily basis or the digestion of the medicine. It is very important to know and assess one's digestive fire, which is the key factor for good health, long life, good ojas or dang, we call in Tibetan, the supreme energy or the vitality. All this depend upon the quality of one digestive fire. Knowing one's digestive fire, or a physician to know the patient's digestive fire, helps how strong the dosage of the medications that one can prescribe and so on. There is this important concept of indigestion, which is considered as the cause of all internal and metabolic disorders. Indigestion, which is documented as the first ever disease in the history of Sowa-Rigpa, is considered as cause of all internal and metabolic disorders. Because of the improper functions of the digestive fire during the process of digestion and absorption, there is this production of unhealthy blood and chusser, or the serum or the plasma ultrafiltrate, which is the essence of the bile. And bile is the waste byproduct of the blood. And bile differentiates into essence as the chusser or the plasma ultrafiltrate, and its waste byproduct as the sediments in the urine, which we talked about during the urine analysis. So because of the indigestion, unhealthy blood and chusser or the plasma ultrafiltrate is produced in our blood, which gets accumulated in liver and over a period of time can cause different kinds of disorders. That's to do with the internal disorders or metabolic disorders such as cancers, tumors, gouts, arthritis, skin disorders, and so many others. So indeed, by treating indigestion, which is the cause of all metabolic and internal disorders, we can prevent so many diseases that is prevalent in today's modern era. Then there is a holistic approach of Sowa-Rigpa in diagnosis and treatment, because of which it is not a generalized treatment that we focus on. Rather, we practice individualized treatment, taking into account all the 10-fold factors which talked about already, based on which we can decide upon severity of the disease and the treatment approach that we can apply to the patient, depending upon how far the patient can respond to the treatment. And there is another important distinctive feature of Sowa-Rigpa is its relationship or integration with the Tibetan astroscience in the field of diagnosis, in the field of application of the treatment, especially the external therapies and many other factors related with the Sowa-Rigpa. Then what is the scope of Sowa-Rigpa? Sowa-Rigpa has a broad scope in various fields, such as you can be a clinician or consultant, academician, or teacher or professor. You can be a clinical research associate, pharmacognosist. You can be a pharmacologist or herbalist, pathologist, nutritionist or dietitian, lifestyle counselor, preventive health care expert. You can even be a health policy maker and administrator in public health care sector. And you can also be in service in the different fields, spirituality center. You can be a literary researcher or a scientific writer, and experts of various fields in medical and co-tourism in wellness center. And next comes the current status of Sowa-Rigpa in India and worldwide. Sowa-Rigpa is recognized by the government of India under the Constitution, under the Indian Medicine Central Council Act 1970 in the year 2010, and it is already gaining popularity in Europe, America, South America, and worldwide. And it is widely practiced in Central Asia, in particular in Tibet and the surrounding countries such as China, India, especially in the Himalayan belt, and Mongolia, Bhutan, Nepal, and Russian Federation. It is also recognized by the government of Switzerland lately. Current Sowa-Rigpa colleges that offers UG, undergraduate BSRMS program in India, which are recognized by the National Commission for Indian System of Medicine, Ministry of Ayush, Government of India, are the parent Sowa-Rigpa Institute in India, which is Minsikhang Tibetan Medical and Astro Institute, situated in Dharamsala, followed by Central Institute of Buddhist Studies, Choklamsar, Ladakh, Leh, and Chakpuri Tibetan Medical Institute in West Bengal, Darjeeling. Fourth is the Central Institute of Higher Tibetan Studies in Sarnath, Varanasi. And fifth is the Namgyal Institute of Tibetology, Deorali, Gangtok. Sixth is the National Institute of Sowa-Rigpa in Ladakh. And seventh is the Mensikhang College and Hospital in Bangalore, Karnataka state. And finally, I have a list of bibliography for your reference. So this is all about my lecture on Introduction to Sowa-Rigpa System of Medicine, which I have outlined under 7 subheadings for you. I would like to request you to go through the slides and wish you all the best. Thank you so much.